A woman's life-threatening battle with high blood pressure and a rare autoimmune disease. A story of survival and the search for answers. Aortic dissection, a near-death experience. MW, a 58-year-old woman, shares her incredible story of survival after an aortic dissection. A dangerous condition that can lead to death. But here's where it gets controversial. Despite her doctor's warnings, MW is hesitant to take blood pressure medication. With only one kidney and a history of side effects, she's concerned about the potential risks. An aortic dissection is a serious event, often caused by uncontrolled hypertension. In MW's case, the dissection has affected her kidney function, leading to a vicious cycle of high blood pressure. Her blood pressure readings are dangerously high, putting her at risk of heart attack, stroke, and further damage to her remaining kidney. But MW is an athlete with a strong heart, and she's defied the odds for over a decade. She questions if she's truly in danger, given her resilience. Dr. Roach emphasizes the importance of finding a suitable blood pressure treatment, assuring MW that with patience, a solution can be found to protect her health while minimizing side effects. Bullous pemphigoid, a rare skin battle. DB, a 73-year-old woman, faces a different challenge with bullous pemphigoid, a rare autoimmune skin disease. She's tried various treatments, including doxycycline, prednisone, and Dupixent, with prednisone being the only effective option. However, the side effects of weight gain and easy bruising are taking a toll. Dr. Roach acknowledges the standard of care DB has received and suggests exploring steroid-sparing medications like Imuran, Dapsone, methotrexate, or mycophenolate. These medications, while safe when used cautiously, offer an alternative to prednisone's long-term effects on the immune system, blood sugar, and bone health. DB is seeking a balance between managing her disease and minimizing side effects. Dr. Roach encourages readers to consider the long-term implications of their treatment choices and to explore all available options. And this is the part most people miss. It's a delicate balance between managing a rare disease and maintaining overall health. What are your thoughts on these complex medical journeys? Share your experiences and insights in the comments below.